मैं डॉक्टर मोहम्मद समीउ जमा आजकल मीन्स आई विल एक्सप्लेन इन इंग्लिश बिकॉज इट इज़ मेनली फॉर डॉक्टर्स. So see, you focus on this. Uh, Once upon a time there was rheumatic heart disease was very common, but nowadays it has become very rare. So this is mitral valve. The leaflets have become thickened and they are not opening properly. So it is called as mitral stenosis. So and because of that there will be back pressure in the lungs, because from the lungs blood may not enter uh, properly into the left atrium, and because there is stenosis in the mitral valve, so the pressure in the lungs will increase, left atrium and lungs will increase, and it is called as pulmonary arterial hypertension. Because of that there will be back pressure in the right sided chambers, and due to that there will be tricuspid regurgitation. I will show you the tricuspid regurgitation. See, this is the tricuspid valve, and because of the left ventricle, because of the pulmonary arterial hypertension, the valve is not able to control the pressure, and there is regurgitation in the regurgitation in the tricuspid valve. So we have to use the medicines to control the heart rate and to control the volume overload, so that the patient will not get breathlessness. So already this lady has underwent balloon mitral valvuloplasty, but again there is some stenosis is remaining, and because of that patient is getting symptoms of breathlessness and chest pain. So see, this mitral valve is not opening properly. The tips of the mitral valve are thickened and calcified. Mild calcification is there. So this is very rare, has become nowadays, but is still common in rural areas. So this is only for those practicing doctors, so they don't know about rheumatic heart disease. Thank you.